The problem with medical education just in general is that we don't talk about how to help somebody be comfortable at the end. We are so busy trying to cure people and help them live as long as possible without asking, well, is this really quality? Or is this the quality the patient wants? That we don't stop and ask, is this really in the patient's best interest?
How do you have that? How do you tell someone that they're dying?
It's not easy. A lot of patients actually have the sense that they are, and you're really just confirming what they already know. Sometimes it's harder for the family to hear than the patient. The patient usually is the one who already knows, but they're protecting their loved ones, so they don't. It's the elephant in the room that nobody wants to talk about. So I have been the object of much anger in many occasions. I've had families that I thought were going to slug me because I was the one who used the C word, and I was not supposed to use the C word, even though the patient knew darn well they had cancer. But you know, we're not allowed to use the word. We're not allowed to say you're dying or your prognosis is poor or whatever. That's not allowed. So there are days where I have thought people are going to throw me physically out of the room, but most people are at least appreciative of my information and then tell me never to come back, which is fine. I've done some family meetings with the interns. Actually, one of the classes I did, I had them role play some actual cases that I've had in the past, and had them be family members or be the physician and be the one who's breaking the bad news and say, okay, Mr. So-and-so, you know, you have terminal cancer and dementia and da-da-da. You know, do you want to pursue treatment? Do you want to be made comfortable and have hospice? What road do you want to go? And there are always other dynamics that I kind of throw in there to make things more interesting for them. Maybe here they haven't had to use what we role played, but down the road in their career, some of them are going to be radiologists, they may not have to go down that road in their career, but at some point in time they may need to have that conversation either with a patient or maybe for a family member or a loved one, and say, and be in the receiving role of having that conversation rather than being the one who's giving it, and understand how that conversation ideally should go, as opposed to the person who stands in the doorway and says, hi, you have 6 months to live, I'm sorry we can't treat you, and walk out the door. You know, you can sit down at the bedside and say, I have some information, do you want to have other family members here? Do you want to hear it by yourself? How would you like to know? Would you like to know? Do you want me to just tell your family members without you? And see what the patient's wishes are. That's really ultimately what needs to be respected.